And everybody, can everybody hear me okay? Great, great. Well, welcome to the B2 Group panel on communications, security, and location in mHealth applications and solutions. That's what this panel will be about. I'm Bob Bilbrook. I'm the CEO of B2 Group. We're a strategic advisory and consulting firm based in Irvine, California that specializes in womb-to-tomb consulting and channel structuring, sales and marketing programs, technology integration for the web, mobile, and emerging technologies. Today we have a great panel lined up for you guys, and I'm going to introduce each of those members, and then they will each give a short presentation, and then we will have some questions that I prepared prior to this, and then we'll open the floor to any questions you guys may have. But our panel is a good one today. Rip Gerber, the CEO of Locate, is on the panel. Sean Moshier, CEO of Siltrust Corporation. Noah Rafalco, CEO of TSG Global. Jared Rietzen, the CEO of MobileStorm. And Rajiv Rajan from Qualcomm Life. So without further ado, I'm going to turn the floor over to Rip Gerber from Locate, and he'll be sharing a presentation with you now.
Great, thank you. Thanks very much. The clicker is here. Thank you. I'm Rip Gerber. I'm with Locate. We are a location-as-a-service platform. We can locate this. Every doctor has one of these, not necessarily an iPhone, but a mobile device. Almost every patient in the U.S. has one of these. Everyone working in healthcare has one of these. And what my platform does and what our company does is locate these any place, anywhere, anytime, without an application, without a patient or a consumer doing anything at all. So why is that important? Let's talk a little bit about this device. That's why we're here at the summit. Everything is mobile today. We live in a mobile economy, a mobile society. A few stats here: 100% plus penetration of wireless devices in U.S. Households, meaning we have more than one device. We might have a tablet, we might have a smartphone, we might have several in our house if we have children or elderly folks living with us. Recent surveys say that half the patients want to link their health care services to their phone. A third of the households in the U.S. don't even have a landline. All they do is communicate on these wireless devices, and these trends are not slowing down. So what does this mean for the industry that we're talking about here in healthcare? There's four examples. There's many examples, but there's four that I'm going to touch upon very briefly, and I think they're familiar to most of you, certainly in other industries. But with the application of mobile into healthcare, we're seeing some new and exciting things, and some of my colleagues and also customers on the panel here will dive in a little bit more detail about things having to do with security and mobile location. But medical equipment and home nursing dispatch, the industry is moving with all the challenges that we have in the healthcare industry to a lot of it being outsourced into the home. It's much like what we've seen in education. A lot of things are happening in the home. And locating very expensive equipment, knowing where those assets are, is an important thing for providers and equipment manufacturers. There's also a big issue with authentication and fraud in the healthcare industry. Is that really your patient using that device and using that service? Is that provider really going to that house to check and provide that service that he or she is contracted to do? And of course, there's a ton of payment fraud that's occurring in healthcare. It's one of the most fraudulent industries, if you will, from a payment perspective, if you compare it to others like retail or manufacturing. And of course, there's the marketing aspects, proximity-based marketing and location-based services and alerts. Very briefly, I'm not going to go through the details. For those of you way in the back, this is probably even blurry images, but essentially this device can locate where a patient, where a doctor, where something is at any point in time, and you can use that location with geofences or compare them to other devices to ensure that fraud is not occurring. We do this today for companies like Visa and Wells Fargo, large banks, and providers even in the e-commerce space, and the new ones like PayPal. Mobile payments to reduce fraud using mobile devices. Another application is home medical equipment tracking. The M2M market is exploding, 40% year-over-year growth. 60 billion devices will be shipped next year. We can track almost anything today. The cost of putting a wireless beacon in a piece of machinery is approaching almost zero, and anything that can be located on a network can be located by my platform. So it could be small as a home reader, as a toaster, and we can identify the location of that and compare that to a patient or a doctor or another piece of equipment. Visiting nurses, fleet management, ambulance tracking, workforce management. It's another application here with a phenomenon called BYOD, which is bring your own device, which is hitting healthcare. And of course, proximity marketing, which as consumers you're all very familiar with. If you walk near a store, you might get an alert that says you have stop in, it's around the corner, get 10% off. That's location-based services applied to marketing. Lots of brands do that today. They use our service from Toys R Us, Sears, Polo, Williams-Sonoma. This is happening in healthcare as well. So that's about it. Again, our platform is the world's largest of location-based services. A lot of folks that are here at this conference are now using us in the healthcare industry to locate any device, anywhere, anytime, utilize our analytics, utilize our geofence engines. We're starting to see more and more traction and attention in the healthcare industry. We do it for banking, we do it for retail, we do it for M2M analytic companies, and I think what you'll see is not me, but more and more people locating devices, patients, doctors in the years to come. Thank you.
Thanks, Reb. Now I introduce Sean Moshier from CellTrust to present his presentation.
Okay, no problem. Well, I guess they're bringing up the PowerPoint. My name is Sean Moshier. I'm the CEO of CellTrust Corporation. CellTrust is in the business of secure communication on the mobile devices, enabling a variety of different platforms, different devices to communicate with each other in encrypted format. Okay, let me see. That's not the presentation, that's your presentation. So, any questions? So far, any questions? Okay. Okay. So we have a variety of different products. The one that I'll be covering in a short presentation here would be the pager replacement. So basically, our focus is, as the healthcare industry is moving forward, it's got to utilize the new technology, and obviously mobile devices bring in a lot of different types of activity and advancement into the field. And we believe that the legacy pagers, their time is up and they need to be replaced with something that's a little bit more powerful. So we do have a device. Basically, it's just like a pager, except it's a the whole infrastructure is very similar to it. It is a smartphone, providing you with the variety of different functionality that you had on the previous pager, except it's HIPAA compliant. It has audit capabilities and lots of different technology that I cover in just a bit. As you can see, today's market, there's 3.5 million pagers that are used, and mostly they're in healthcare and public sector. And the Paging Association basically changing their name to Critical Messaging Association tells you that alerting and notification and getting hold of the individual on a timely basis is becoming very important. And utilizing the existing infrastructure to do that in a timely manner is their goal. The legacy pagers, as you can see, is just, as far as encryption, it didn't really exist. It was not HIPAA compliant. It's one-way communication. There are some two-way communication pagers. And if you do miss a page and you're in an area that the signal is not strong enough to receive a page, when you get to the area where there is a signal, there is no retry trying to get that notification to you, so you actually missed a page. So it's quite common for physicians to miss some of the pages. Now, what we offer, obviously, with partnership, with the carrier T-Mobile, is to provide pager replacement, legacy pager replacement with the smartphones. And the application that we put on the pager allows you to go through a variety of different functionality, and you're able now to send exactly what the problem is. So if the nurse is paging a doctor, they just don't have to put just a callback. They could tell the doctor exactly what the issues are because the device is HIPAA compliant. It has 2 factors of authentication. All of the communication is encrypted, and that goes both from the hospital to the handset back to the hospital. And it seamlessly work in a variety of different network and infrastructure that's already out there. And the cost of owning one of these smart devices is actually less than a legacy pager. So you can see that the technology advancement is making things much faster and better and cheaper. As you can see, just quickly, the message size, you can send up to 5,000 characters in one single page. You have a variety of different controls. Once your page is received by the device, the nurse or whoever paged you will actually see on their console that your device has received the page. And if you open and read the message, they would get another notification, so they would know that you actually opened the page and you're reading the instruction that was sent to them. And you can simply, whoever got the page could simply reply back. We have a pager console which integrates with a variety of different platforms. It's web-based, so all you need is just a link from any existing browser or platform or application. It'll basically allow you to access the platform fairly quickly because it's web-based, straightforward. And in here is where you can actually find out if the page was made and if whoever's within the range have responded or not. Some of the steps to protecting ePHI to be HIPAA compliant. Obviously, we've made sure all of those things are covered, such as password protection, encryption, and security compliance that we've put, including data loss prevention. If the pager is lost, you could just remotely wipe the device. If there was any information on it, could be wiped out. And as far as the encryption goes, we've got 256-bit AES encryption, typically used it's a government-grade encryption, so it's fairly strong. And with the HIPAA compliant solution, one of the things that we also offer is the auditing capability that's built into the product. Allows reports of different things to be generated, so you could potentially see when somebody was paged and when they received it and when they responded, and obviously with redundancy. So if you're in an area where reception is weak, and as a lot of you have seen, sometimes you get a little notification that says you have a voicemail. but the phone never rang because there wasn't enough bandwidth to have a communication, but there was enough bandwidth to send a single SMS to tell you that there was a voicemail. So we have that redundancy, meaning that we can page you even if the data is weak and there's not a whole lot of reception, but there is enough to get some of the packets through. We'll still notify you and page you. As far as the user interface goes, it's very similar to existing SMS, so a lot of people have already familiarity with it. And we support all of the variety of different platforms, which is an app that you can put on the different devices. But the pager that we are promoting is a device preloaded and installed, and it's managed by the hospital that gives away the pager. However, you can put the app on a variety of different handsets, but once you do that, then it becomes the issue of whose liability is it if the handset is compromised. And that concludes my presentation. Thank you.
Thanks, Sean. We're going to hold questions until the end, so keep those questions in mind as we move through these presentations. Are you guys loading the next one there? So we don't have the problem we had last time, and then we'll just go off of that. Perfect. Coming up here now is Rajiv Rajan from Qualcomm Life. He'll be sharing some stuff about TwoNet and some of their great new platforms.
Thank you, Bob, and thank you, everybody, for the opportunity to be here. Talk to you today about Qualcomm Life as well as our product line, TwoNet. So it's our one-year anniversary. We were here last year. We announced the launch of Qualcomm Life as well as the TwoNet product line, and it's been a wonderful year. We are glad to be back. We also announced a $100 million venture fund focusing on investment in the wireless healthcare space, as well as over the last year, we've grown our ecosystem to be more than 180 plus customers and partners. We had the launch in Europe with the dedicated data center there in Amsterdam in Q4 of 2012 in November, and today we announced in the press that we are also going to Canada. So good progress for us. What is our mission? To mobilize healthcare. We are a cell phone company, and obviously mobilization is in everybody's mind. So let me ask you a question. Who doesn't have a cell phone here or a smartphone? You don't? No, you need to come and see us. So that's where it seems that we're all going. As well as metaphorically speaking, we like to think that we're building a wireless health network which allows the world access to healthcare anywhere, anytime. So this is an interesting statistic, and I always get some smiles when I put it up there. More people have access to cell phones than drinking water, electricity, or toothbrushes. So that kind of, tomorrow morning when you're brushing your teeth, think of that. The number of mobile devices has overtaken the worldwide population. According to recent statistics, it's about 6.4 billion mobile devices out there. The world population is less than 7 billion, so it's definitely an interesting statistic. We all know this. Healthcare is a critical global issue. The first three are worldwide numbers. The last one is a U.S. number, $300 billion compliance issue versus, that statistic is always interesting for me, that 300 million people in North America and EU have at least one chronic disease. It is a big problem, and I think all of us in this conference and room are focused in how do we make this better. So Qualcomm Life itself, we have expanded into different areas. We are focused in research, education, parts of trade organizations, obviously the investment portfolio, government affairs, standards, Qualcomm Wireless Health pavilions that we host with our partners, as well as different opportunities to innovate. Some of you may have heard about the Qualcomm Tricorder X Prize. Any Trekkie fans, Star Trek fans? There's one. Well, in Star Trek, it's interesting when Mr. Spock and Captain Kirk went down and they found somebody in dire straits. They had a little tricorder device, something like this, which used to go t-t-t-t-t on the body, and it used to show them what's wrong with a person. So that's a challenge which is out there. Can we build a tricorder-like device which helps you diagnose what's wrong with a person? Many years ago, that was, a challenge. Now, it may be possible. That's what people are saying. This is a splash of the ecosystem and the different partners that we have. So I won't go into details, but there are quite a few. In terms of our investment fund, these are the companies that we have actively invested in so far. There's definitely opportunity to grow in this space, and some of these have been in the headlines recently, Airstrip, after they got a new patent awarded to them, and a few others. I think AliveCore just announced that they got FDA clearance today, I believe. So the TUNET system itself, so from a use case scenario, what is it? So at the heart of this is what we call the TUNET hub, which is the little device in white which you plug into a wall. It has multiple short-range radios like Bluetooth and plus Wi-Fi and a USB connector. Different people who take readings at home or elsewhere through medical devices. The readings over short-range radio wireless get sent to the hub, and then we go over a secure 3G network onto our platform, and from there we disseminate the data to our partners and customer, whoever needs to see the data. So from an end-to-end snapshot, this is what the TUNET system does. The TUNET hub as well as the platform are both FDA-listed Class 1 MDDS medical device data systems, and we'll talk about that a little bit further. So from an end-to-end standpoint, this is another way to represent the previous slide, but what I wanted to show you is we think about it as different gateways which connect to the platform. So the hub is one gateway, mobile devices and apps, embedded devices, as well as a server-to-server integration are different ways in which you can connect to our platform and then benefit from it. So this is how TUNET as the hub would typically get packaged in with other kits for like diabetes management, congestive heart failure, so on and so forth. So it gets packaged as part of the solution. And then this is our back-end platform. We leverage a lot of operations, device management, network management, data management on the back end. It is a highly secure platform, and we are able to leverage this to build a more secure system on the security aspect. So when we were building TUNET, these are some of the aspects that we have to keep in mind from an end-to-end standpoint. How do we manage the data, the biometric data that we get from different medical fitness, other devices? What's the secure over-the-air transport? How do we store the data, integrity, secure protocols, as well as when the data is at rest at the data center, what's the security that we need to put in place there? So these are the different levels that we build upon in the TUNET system. And we're able to leverage this based on our expertise, Qualcomm's expertise in the M2M space. We've been operating this for about 25 years now in 40 countries, 4 continents. We have 8 dedicated NOCs and a ton of messages that get transacted. So obviously we were able to leverage those learnings and bring them back in as we built the TUNET system for healthcare. So hopefully that gave you a little bit of insight into TUNET, and thank you again for being a part of the panel.
Thank you, Rajiv. That's the one great thing about this panel is you have a wide variety of different solutions that cover a wide gamut of application solutions within mHealth. So think of those questions as we go along here and see all these great applications and solutions. As they load the next presentation back there, I believe our next presentation is going to be TSG Global. If not, whatever, they get loaded back up there. Noah Rifalco is the CEO of TSG Global. They are the dominant player in long codes, and Noah's going to share a little bit about what they're doing in that space and how it plays to healthcare. Here's Noah.
Thanks, Bob. Hi, everybody. Anybody hear of text messaging yet? Anybody run into it at all? Anybody have any kids, perhaps? They prefer to text message over voice. And coming from a voice consultative history, I've been in the business quite a while. I hide my gray well. But I do come from telecommunications and communications as a whole. And that being said, TSG Global has come a long way with me. So if we understand how communications plays out today, just think of how you used to communicate with everyone in your family, and it's this simple, and how you communicate today. So the evolution of communications has really matched our personalities in the United States being snack-based. And what I mean by snack-based is a conversation on a telephone line with, let's say, my grandmother about 15 years ago, or maybe every 30 seconds I'd hear, well, we should hang up now. It's going to cost us too much money. And that might have gone on for hours because family loves to talk. But that being said, now if we fast forward and we look at today's ecosystem, we talk about email, IM, text messaging. And text messaging is easy because you know you only have 160 characters to get your point across. Maybe that's why my kids like me responding to them in text as opposed to communicating with them via voice. But if we look at TSG Global and the unique position we are in, it's an amazing position because here we are at the cusp of another communications evolution, and that's using text messaging. What a novel thought. We use it in our daily lives every which way, but in our business. Or very few use it in business because it's really an unreachable goal unless you have enough money to get into that market. Well, long code technology is a very simple solution. All it is a 10-digit phone number virtualized into the mobile ecosystem. So what does that play into? Where could we take that? Well, you could take it in every vertical. And if you can communicate, you can collaborate. And when you can collaborate and communicate, you can engage. And when you do that, you get the best out of a group. And no one man is an island, right? So if you can collaborate and communicate, what can you do with this? You can add a device that sits in the home that can tie in all medical devices and feed that information through an application layer back to a healthcare provider. You can become HIPAA compliant, and you could embed an encryption component to it so that all that communications is secure. And you can also take it to another level, being LBS, application-based services. So now you can know where those people are residing at that moment as well. So if you combine these and you take the advantage of a simple telephone technology, then that's where you meet TSG. TSG really came into the space as a long code technology pioneer because I came from communications as a whole. When I saw the ability for a regular 10-digit phone number to become a virtualized mobile presence, it really tied the expression unified communications together for me. Because up until that point, I didn't feel it was unified. I felt it was missing a component that I use daily. So what is a best-of-class technology platform? Best-of-technology really means that you're bringing a technology that's very complicated behind the scenes to a very simplistic level so that all can incorporate, but giving the best-of-class solution to that. So if you take a consumer-driven technology like a phone number and you apply many different application layers to it, you can create anything. And that's where it comes into understanding healthcare. And healthcare is a very complicated vertical. But the most important thing is it doesn't have a lot of money. So how do you engage into saving money for both the organization that provides the healthcare and the user, and eventually to the whole healthcare system? Communication, collaboration, and engagement. When you leave a hospital, typically there's very little follow-up that's outside of the next doctor's appointment. If you're lucky enough, maybe you'll have a nurse visit you, or maybe they say they're going to visit you and they just say they visited you. But really, if you had that bridge to save the healthcare system from recurring medical events, which a lot of the events that happen are post-care. So how do you minimize that to save the whole ecosystem an enormous amount of money? Communication. What's the least common denominator for communication? Well, there's voice, and voice is still the, the top dog there. But next in line, as I mentioned, is texting. Texting is a very simple way to communicate exact points of information to gather the most specific data to create what you need. And in the case of healthcare, you're creating a healthy individual at a low cost. And isn't that much more important than letting them come back to the hospital over and over? And I'm also a business owner, like most of the people on the board, and that means a lot to my business as well, to keep overall healthcare costs down. Now, when we talk about the invisible hand, that's where I really talk about saving everything from its core. So if you can save the healthcare companies and providers money, that is the trickle-down effect. Then you start saving costs for your own healthcare plans, maybe for your insurance. I mean, this is where it can lead to. So by involving a least expensive, least common denominator technology such as text messaging through long code, you are enabling that provider and the consumer of that provider services a cheap, inexpensive way to keep them healthy. And that's very important to society. So when you talk about reduction of costs, if we look at the two technologies that are available today, and I'm sure people have heard of short codes, and if you haven't, the easiest association I can give most folks is the voting at the end of a American Idol, where it would say text your vote to this 5-digit number. That is what a short code is. It's the ability to text a sequence of numbers that can be aggregated to a certain point of delivery. And that's been out for quite a while. Long code hasn't, at least since the short code began. So short codes are expensive to maintain. They're not very efficient to get standing up very quickly, and it puts a lot of healthcare solutions out of reach because of the cost. Long codes are generally $1 or less per month as opposed to $500 for a short code, and it allows you the ownership of that number because now it can be tied to that medical office, to that provider, to that region, and you control all transactions through it. So that's where the savings lie. If I can incorporate an inexpensive solution to communicate with the people that I need to communicate with without being an overbearing cost, then it's going to save the entire system more money. How do you remove human element from this? Well, we are designing solutions with some of our strategic partners for complete scripting of mobile interactions, so that even if you're in need of something simple, like a frequently asked question, maybe a healthcare issue that you're not sure if you should go into your provider or not, these can be pre-scripted, so at least they can augment their team. It's not a replacement, but it allows human intervention to be slightly removed to where it's really needed, and then, therefore, again, saving costs. Information flow is critical in today's time. So when you talk about quick delivery and reliable delivery, you really talk, as Sean did, when you can receive a text message, it's a very small piece of data that it takes. So it doesn't take a lot to receive or send that data. And if everyone can remember, some of the events from our past that, where voice services failed in major catastrophes, text messaging worked. When you have the ability to improve that communication and have that constant communication where the caregiver can communicate with the individual, they can communicate those fears that they may have more so than if they came to the doctor's office or tried to get past their own fears of coming back into the hospital. A simple communication like a text can put that into the provider's hands to make that determination to save that person's life in some cases, or to at least minimize their involvement as a provider. because everyone likes to be healthy, but they don't want to have everyone on top of them to do it. It's more of an interactive play. Now, how can you use long code in healthcare? Well, it's very simple. When you have cost reduction, it allows you to deploy applications at a much more cost-effective rate. So you can experiment with much more cost-effective, interactive applications with the end users. What does that do? That allows you to speed up information and save time and money for both of you. If you can improve that communication, you of course are improving the health care to that individual, minimizing return, as I mentioned earlier. And I'm going to wrap it up quick because I know that we need to get to some questions and there's one more speaker as well. So basically, the long code and TSG being an enabler of this long code, we're helping telephone companies create that environment for every person in this room, whether they're using it for their residents or whether they're using it for their business. When you allow yourself to create innovative applications, you allow yourself to be the phone call over the telegraph wire, if that makes any sense. That innovation that layers on top of another innovation. And that's what every board member here has done. And we are that innovator underneath. So we power all these application providers to allow them to use a lesser expensive cost solution with the same impact. So with the next time you, any of you, text message, imagine being able to text that freely to whether it's your healthcare provider, whether it's the business up the street, maybe to a group of your family that is being caregivers to a single individual in your family. This is the way that we can communicate, collaborate, and engage. And through TSG Global, we're happy to be part of this ecosystem and happy to help everyone. Thank you very much.
Thanks, Noah. To wrap up our presentations, we're going to have Jared Rietzen from Mobile Storm.
Hey guys, I'm going to level with you here. I'm literally going to get on the same level with you. I was a little claustrophobic up there past the table. Okay. Starting my icon here. How you guys doing? Good? You guys still awake? You want to stand up and shake it out or just want me to go on? All right. So I'm the CEO of a company called Mobile Storm. And we've been in business 13 years, primarily focused on helping marketers reach consumers to influence their behavior, and more to the point around smartphones and engaging with patients and consumers on smartphones. We have a big mission because we're not just a multi-channel communication platform, but we're actually trying to figure out how to become the most intelligent communication platform. And what that means is taking in lots of data about how people are engaging with messages. Push notifications, text messages. You know, obviously, we have location now. We can find out where somebody is. People are opening messages, they're clicking on links. And all of this data we've been collecting for many years. And it's interesting how we actually got into the healthcare space. We ended up getting a deal with Kaiser Permanente about 4.5 years ago to help them reduce missed appointments with text messages. And it was such a powerful thing for them that was about a 300% ROI. And so we kind of all of a sudden found ourselves getting a lot of phone calls from people going, hey, we want to do the same stuff. And we've been working with marketers for so many years. And we just decided to make a decision. You know, we got to look into this healthcare thing. There could be something to it. And the more and more we peeled the layers of the onion back, the more we realized that the space is huge. And we're extremely excited about 2 to 3 year sales cycles. It's fantastic. So we actually help our clients reach the right person with the right message at the right time. We actually call it the relevancy stack. So we have partners like Locade, which provide data on where people are. We have information on what's the right device to reach somebody on, what's the right message, what's the right channel, what's the right context, is it cold outside, is it hot outside, and be able to use that data. So we are, let's just keep moving on here. We have a few clients, mostly from a healthcare perspective, we're focused on payers, providers, pharmacy, and pharma. We call it P4. It's kind of our P4 strategy. And we talked a little about HIPAA. Obviously, within HIPAA, there's something called the High-Tech Act. And in high-tech, there's something called PHI, and I'm going to get through this quickly because you guys are familiar with this, but PHI is anytime you link up somebody's personal identifiable information with a condition. And, according to high-tech and HIPAA, this information needs to be encrypted. So we've been talking a lot about security today and being able to, reach patients and members and engage them. And if you do that, and you're sending sensitive information, and you do that over 4 different channels of communication, you could find yourself in hot water if that data leaked out, because there are some real serious fines that can happen. So what I'm going to do is I'm going to go through a number of different channels. And by the way, we're a multi-channel platform, so I'm not necessarily throwing any one channel under the bus, but we do want to show you that there are kinds of interesting ways to communicate with people, and there are pros and cons to each of these channels. So when you think about email, both in a sort of a bulk campaign or even individual transactional email messages, there's some really great stats. If you're a marketer, every dollar you spend, you should get $46 back. You obviously can get detailed reports on engagement, rich content. It shows images, links, pictures, and you have some interesting conversion rates, certainly better than that of direct mail, anywhere between 5 to 15%, really depending upon the call to action. Some of the pros and cons would be deliverability. 25% of email goes undelivered, and 33% of email addresses change on a yearly basis. So if you're messaging to a database, a third of it's going to churn out within a year, and it's something important that you need to obviously diversify and be able to communicate in other ways. SMS. We just got through talking a little bit about that. Obviously, extremely high delivery rates. It's almost virtually, guaranteed to get to the device as long as they're in reception. I've heard it's between 86 to 95% of text messages are read within the first 4 minutes. So that's a powerful, powerful channel because it interrupts somebody's day. They pull it out of their pocket, and you have their attention. It's inexpensive compared to other legacy channels. Conversion rates we've seen as high as, it's typically 20%, but we've seen as high as 90% depending upon sort of what the call to action is. And if you're offering somebody a free car, I guess they'll respond nicely over any channel. But SMS is fantastic in that way. And contrary to popular opinion, SMS is actually one of the fastest growing channels above the age of, actually, this is a little incorrect. It's actually the fastest growing age segment's above 55 right now. I mean, because let's face it, everybody under 55 is already text messaging. I hope I didn't offend anybody in the room over 55, but they are being taught by their grandkids and their kids on how to text. So from a con perspective, there's character limitations. Obviously, it's not a secure channel. From the carrier to the end user is not encrypted. There's very limited reporting. And short codes, as somebody mentioned up here earlier, they're expensive and they take a while to get up and running. Next is push notifications, something that's becoming more and more popular now as mobile apps are proliferating and smartphones are now adopted at 50%. So some of the cons, some of the pros, unbelievable open rates. Urban Airship did a study recently that as much as 500 and you can increase your app usage in a day as much as 540%. You could push people to social media 30% more. So it's just a tremendous channel to be able to reach somebody. It's cheap right now compared to other channels like SMS, very high throughput. You can have a little jingle when that message pops in, and a badge can show up on the app to say that you have a new message waiting for you, like that. And some cons, I like to say we're at 50% smartphone penetration. I'm jumping up and down. I'm saying, yeah, that's fantastic. But then again, you also have to look at it that we are only at 50% and we still have ways to go. There are acquisitions and opt-in challenges. Not everybody wants to push that button to say, yes, I want to receive a push notification. It's not interactive. It just pushes you information, and that's that. You can click view, you can click close. Not much flexibility with call to action, meaning you can't necessarily send them anywhere by having them click on view. And of course, just like SMS, there's some formatting in terms of character limitations. I think it's about 255, and it is not secure. You would not want to include PHI within a push notification. Direct mail. Well, we don't have to talk too much about this, but you can include PHI, and there is a rich content experience. But it is, if you're a health plan, 80 to 85% of your budget is direct mail. So I have a client that has a $220 million a year communication budget, and 85% of that goes to direct mail. And there's a lot of pieces of direct mail that can be easily ported over into a different type of channel, like a mobile app experience that's secure. And obviously, conversion rates are low. We always have that failure points. A dog can just chase the mailman away or eat your mail, so there's some issues there. You're not typing in username and password to open up the envelope, so it's not necessarily the most secure way. And as far as the younger demographic, they don't understand what paper is. They're not necessarily sure how to hold it, and then they'll just ask you for an iPad. IVR, we are looking at 99.9% of people own a telephone, which is great, not necessarily a home phone anymore, as I believe Rip pointed out to us. And it certainly is becoming a preferable channel for an older demographic. Not many people they want to just text nowadays, and they want to see a message quickly and be able to decide if they want to respond to or not. And so that's obviously some of the cons, just in the legacy channel. There's risks with do not call lists and stuff if you're doing large scale campaigns, large scale messaging. Social media, you look at social media, you have, obviously a younger, sort of savvy demographic, high income levels. It can go viral quickly. It's adopted like crazy. There's all kinds of engagement. It's inexpensive. It's interactive. But obviously, it's not secure unless, of course, we're talking about a secure social network. But in this case, I'm not. We're talking about the lack of availability to build and own a database. Like I have a database of email addresses that I own and I can send messages to. And there's a lack of necessarily of targeting. So when you start looking at the cost of HIPAA violations and maybe communicating with your audience over these channels that aren't secure, this is just a number of the different companies that have been sued and or fined, I should say, for millions of dollars because of these HIPAA violations. You also have PHI and non-PHI use cases. If you look at both, if you look at SMS push email, you look at all these channels we talked about, and you kind of look on the left-hand side, you'll see payers and providers, and then those small little tabs, you'll notice that there are kind of segments within each of those, so specialty hospitals, physician groups. And then you start looking over here to the right-hand side, these are the use cases. So point reminders and scheduling as a customer touch point. You can send messages and it doesn't have to include PHI. Same thing with targeted marketing. If I want to acquire a new customer and I'm a health plan, I don't have to necessarily include PHI. But then when you get into PHI under things like appointments and refill reminders and billing and customer service, disease management, medication adherence, there's obviously a lot of use cases here that need to include PHI. Mobile Storm's all about making sure that we reach our audience and we help our customers reach their consumers in the most relevant way possible. And so when you look at the gray area of communication, a message containing PHI, don't forget to take your 15 milligrams of Lipitor at 5 p.m., versus a message that doesn't have PHI, don't forget to take your medication. I mean, obviously you can tell the one, if I can say the one on the left-hand side, it's going to be much more powerful, and I might have a much better chance at changing the outcome. We all know that medication adherence is a $300 billion a year problem in America. And then, of course, there's that gray area, and people are really worried and concerned about that gray area. So there is a need to reach consumers securely. Real quickly, this is smartphone adoption going from 2011 or 10 all the way to 2016. I think we're being a little generous here, but 75% smartphone penetration. People are going to be downloading mobile apps, mobile games, surfing on the web, going to mobile websites, texting, receiving push notifications. Bottom left-hand side down here, we have the number of mHealth users going from about 60 million almost to 120 million by 2016. So there is obviously a real need to be able to communicate securely, and a need is becoming more and more important as these fines are right there and in people's faces and could cost people a lot of money. So we've invented a new technology that allows our customers to reach their customers. And we have this little saying that reach people where they want to be reached, become part of their existing habits. You want to inject yourself into the normal workflow of what your consumers used to doing. They're used to getting messages and taking their phone out. And so I have a demo right here. I'm not going to be able to get into it because I don't even have a computer to access if I wanted to. But we really offer sort of this multi-channel communication platform. It's SaaS. It's a cloud-based communication platform, or SaaS. We offer a set of APIs so that you can hook that up to any system, whether it's an EHR platform, a claims management system, pharmacy benefit solution, appointment reminder system, you name it. And we can power secure messages down to smartphones. And what we offer is an SDK. So it's an SDK, stands for Software Development Kit. We can give it to any developer who has a mobile app or site, and they can very easily embed that in their mobile app and create an inbox. And then we give you a control panel to do campaign management, to send messages securely to that inbox, or a set of APIs to automate messaging to that inbox. So it's a really unique, we've been selling it now for about a year and a half, and we're getting just unbelievably tremendous impact within the industry, working with the top companies in each of those categories I mentioned earlier. Just some real quick, some features. You can send ePHI. It's fully HIPAA compliant. We offer, it's member centric. So if you have your wife's phone, you can log in. And if you're a member of, let's say, Humana, and you can check your messages on her device. We offer real-time event-based callback. So as people are opening messages, we can tell you how long they're looking at messages for, what message they're looking at, what links they're clicking on, all that great engagement data. And then, of course, you can send messages back based upon what that engagement's like. And so there's some rules you can set up in terms of triggering out messages. You know, if they didn't open this message, send them a push notification 15 minutes later. And if they don't read that push notification, send them a text message 20 minutes later after that. So, real quickly, to wrap things up here. App Mail, it's fantastic. It's great. You should use it if you have an app. If you don't, then this was a waste of time. And you know what? We're running over time here, aren't we? Okay. All right. So thank you guys very much. I appreciate it.
Thank you, Jared. Thanks, Jared, for that overview. We're going to transition into the question and answer period now. I have some prepared questions and answers for the panel, but I want to make this interactive with you guys too, so maybe I'll ask a couple questions and then I'll go out to the audience if you guys have any questions. The first question I have is geared towards Rajiv at Qualcomm. Can you elaborate on some of the key security aspects around TUNET? I know that's a question a lot of people have in their minds, and as I looked at the TUNET platform, there's questions I have. Maybe you can share a little bit about that.
Sure. No, that's a good question. You know, if you remember that use case diagram that was up there, if you go from left to right, you know, there's obviously the medical device or the fitness device, healthcare device, that transmits data to a hub or a gateway. There's short-range communication involved there. So what are some of the security aspects involved there? It's obviously it has to be a secure communication, but then what's the level of trust that you put into the device? Like a Bluetooth device typically has a Bluetooth address, which is, so to speak, burned into the device. Do you trust that address to be coming from that Bluetooth device? If you do, then that's the level of trust you accept, and that's good. But if somebody spoofs that address, the same thing with a Wi-Fi address, if somebody spoofs it, then how do you manage that situation? So we need to be prepared with those kind of elements on the TUNET hub. Then once we get the data out from the medical device or healthcare device and it lands on the hub, the data is at rest for a little while. You know, how do we prevent the data getting, or the hub getting hacked into, or somebody can get access into the data? Once the data moves out from the gateway over the air, the cellular network, and gets to the cloud platform, what are the levels of security that you put in there? Secure transport, any other additional kind of encryption that you want to put in there? Is it a private network versus a public network? Once it's in the cloud and in a data center resident, it could be at rest, it could be moving, transporting out delivery to a third party. Well, how do you secure the data once it's in the data center itself? What are the different levels of controls that you put in, whether it's HIPAA, whether it's standard security, whether it's PCI level 1 merchant kind of security, based on the kind of transaction that needs to be offered. And from that point on, when you deliver it to your end partner or party on the other side, how secure is that delivery? Typically over the air, we have seen that the de facto standard is HTTPS SSL, but there could be additional ways in which you need to secure the data. And then, you know, someone was talked about ePHI. If the data does have protected health information in it, then who is the responsible party which is tying together the device as well as the patient's information? And there is a secure aspect that has to be in place there, because if somebody intercepts the data and has patient information in it, then obviously we don't want that to be compromised. So I think these are some of the elements that we have to keep in mind.
Perfect, thank you. I'll invite anybody to come up to the mic. I'm going to ask another question here, but if you have questions, just come up to the mics and then I'll cue you. Go ahead.
This question is for TSG. Is there any advantage with the long code as far as compliance or auditing or anything because you're using regular phone? Does it create a problem or?
Well, right now there is no HIPAA compliance on texting, for example. It's not actually, they take a while to catch up, but you should expect that type of compliance in place. But I really like the gray area idea because you don't necessarily have to give specific patient information, for example. You can be very creative in how you communicate, because that's how we all are today. You know, you can tie it in with something a little bit more elaborate, like a Qualcomm solution, or, you know, then you can get into the cell trust, and then to really ensure HIPAA compliancy, you can tie it into the LBS too, so that you know that the person is the person, so that there's no spoofing going on, that you identify there in the local area. But what I would say is that you don't have any concerns about security or compliance at this point that are, you know, documented.
Thanks.
One of the things he mentioned was the auditing of it, or
Oh,
audit
on the
trails and
sense-
all that, so I was just curious.
No, that's a
There's a better
great
way
point.
of capturing
Yes.
the information.
For example, BYOD is a big thing happening right now, and how do you capture all that data? And you can even bring that into the family, you know, and say, how do I capture all this communication that's going on? Well, through other methodology, whether it's through your regular cell phone communication, you don't have the ability to go back and get that data. It would take a subpoena to a wireless provider to do that. So with the solution of long code, for example, you control all communications that flow in and out of that service, so that you can have full auditing capabilities.
Thanks, Noah. This question I want to gear towards Sean. Sean, in your opinion, what new policies should be considered for mobile health care?
I'm sorry?
What new policies should be considered for mobile health care, in your opinion?
Sure. I guess, you know, once mobile devices are being used within the healthcare industry, the policies usually are lagging and they're behind, but they catch up fairly quickly. And when it comes to, you know, HIPAA compliancy and keeping the data secure, not only policies go as far as communication that has to be encrypted, but you have to have policies for when the data is at rest, meaning that if the data is, you have information saved on the handset inside a database, if the information is on a database at a terminal or a computer at the nurses or within the hospital, or when they back up information on a backup tape. There's been like a variety of different scenarios where they've done all of the above, but, you know, information being backed up wasn't secure, so anybody having access to the backup tapes could actually go in there and access a lot of the information. So when you're looking at mobile and you're looking at the intersection of that with the security and the policies that's going to come in, a variety of different things has to kick in, as I mentioned. And on top of those are the obviously the authentications of the users who actually do the communication. For example, right now we've seen in a variety of different, you know, scenarios that I talked about, pager replacement, where you can just go to a website without logging in or anything. You can just put a phone number and that'll page somebody to, you know, call you back. You didn't have to authenticate against anything specific. We've seen in a variety of the hospital that's just a simple link. It didn't have a, you know, login prompt or anything. So all of these different things come into place, and in order to protect the ePHI and having to be compliant, you need to take a lot of different things into consideration.
Thanks, Sean. Rip, this question I want to gear towards you. There's, for most people, location, and especially when you, location of mobile, and especially location of mobile in healthcare, is kind of a mystery world to them. Perhaps you can outline for us and go into a little detail about the different technologies out there today and kind of some of the benefits and downfalls of each.
How long do you have?
I know, that's a big question.
Real briefly, there are three primary types of location. There are a few dozen systems of satellites that go around. That's GPS location. There are about 290,000 cell towers in this country alone. That's called cellular network location. And there's millions of Wi-Fi access points in this building and buildings all across the country. Each one of those location technologies provide location information very differently on accuracy, on speed, latency, and cost. What you're all probably used to, what we're used to, is getting on a smartphone and an app saying, this app wants to use your location. Will you allow it? Yes or no, and you hit yes or no. That's called device-based location. It might use any one of those three technologies, but it's the device knowing where that device is and then sharing that with you. Network location is very different, and that's what our platform provides a big value-added service for. Is network location can locate any device, anytime, doesn't have to have an app, doesn't have to be a smartphone, and it can't be spoofed. So that's kind of a quick rundown, but if you want to spend a day going through the technologies, we could do that tomorrow.
Thank you. That's perfect. Thank you, Rip.
Can I say something there?
Yep. You go ahead, Jerry.
Yeah. It's just been interesting what Rip's company's been able to do. Sending SMS messages for many years, the carriers were just deathly afraid of giving up their consumers' location, really any information. And I really think, and I attribute this really to Mark Zuckerberg and his push with Facebook to really, open up the boundaries of what really privacy is. And I think even though that wasn't necessarily just a direct correlation, I think a lot of those types of things have really allowed the carriers eventually to get comfortable with it and to trust companies like his. And be able to allow that information. Now, of course, consumers have to double opt in, and they have to definitely say, yes, I want you to know where I am. But I just think it's fascinating that we can send a text message to somebody without an app, which has been really the holy grail that a company like myself that's had a mobile marketing platform for so many years has been looking for. And it's amazing because when I first interacted with your company maybe 2-3 years ago, there was one carrier that was supporting it. And now I'm blown away that all of them are. I'm not blown away, but I'm just happy that they're all on board finally, because it did take a while.
That actually leads me into the question I was going to have for you, Jared, is we talk a lot about HIPAA compliance within messaging. There's a lot of challenges there, obviously, and there really is no formal process today. Maybe you can talk through, maybe in particular your experience with Kaiser, about what is involved in that process and timeframes and things like that.
We're not. I would say we're not the HIPAA police. So, and we have really great indemnification clauses. But we'll let anybody use our platform and send messages, and our account managers will certainly do their best to provide our customers with best practices as far as what they should say or not say over certain messages. But we tell them, listen, if you're not sure, then why don't you send send it through a channel that absolutely is encrypted. And there's a few solutions out there in the marketplace. But obviously there's pros and cons to that. SMS is such a great way to reach somebody so immediately. And there is, I was talking to a gentleman earlier, there's some, there's certain like clinical trials, people will sort of waive their rights to HIPAA and still allow ePHI over SMS. So it can happen, it's just a matter of the customer base. But we don't really try to steer our customers in either direction. I mean, if we see something in an SMS message and it says, you've got diabetes, come and talk to us, we might tell the customer, you might want to check with your legal before you send it out, but we're not going to necessarily stop that message. And people use our platform, it's self-service, so we wouldn't be able to anyways. And no, we don't have filtering yet, but we've been asked for it a lot.
Okay, great. Thank you. That actually leads me to my next question for Noah from TSG. There's been a lot of contention between short codes and long codes. There's a lot of evangelism going on now for long codes. I know there's a lot of work going on within the Mobile Marketing Association currently around that. Perhaps you can outline for us, in your opinion, why there is such contention between short codes and long codes and why so many people believe long codes is not even a usable form of messaging in some applications and solutions.
I can wrap that up in one word: money. Really a driving factor in short codes is it's a island created in the sea of telecom. So in other words, there's no regulations really except control by those very few, some of which are referred to as the cartel, being the wireless providers. So if you are a very small group of people, and it reminds me of the Great Men Who Made America show. I don't know if many people watched it, but think of that very small group of people controlling the nation, right? That's what this reminds me of. So breaking into that, you know, in some cases takes governmental action. You know, when it reminded me of AT&T's breakup back in the Bill McGowan MCI days. You know, it takes that kind of force of nature, and it usually takes the American public to do it. But this is a driving force in a lesser cost service. So you're talking about a very expensive solution being told to everybody it's expensive compared to a common everyday solution that you use that's now unlimited. Well, of course there's going to be contention in that. You're talking about taking the purse away from an amazing amount of, an amazing amount, 3 or 4 providers. You're taking money away from these providers and you're spreading the wealth like Robin Hood, because now you can apply all these different use cases and applications at a much lesser cost, so it's going to create innovation. And if you've ever watched anything about, you know, how money flows, innovation is always stifled by monopolies of that nature. So that's how I would put it.
Thanks a lot. Thanks a lot. I do encourage you guys to ask some questions. Also, if you want to come up to the mic and ask questions, feel free to just walk up and ask. One observation that I've had over the last couple of weeks is B2 Group does a lot of advisory to venture capital groups. It was actually funny because to a lot of the venture capital groups, they're kind of a little bit late to the game here on mHealth. We've all been here, or most of us have been here the last 6 to 7 years working away at this industry. And now some of the VCs, the capital guys are coming into the market and asking, you know, where's the sweet spot? Where's the, you know, low-hanging fruit in this marketplace? And I actually kind of chuckled on our call the other day with one of those groups because it's, you know, it's like being in the early, or like in the late 80s, early 90s and asking, where's the sweet spot in the web? I mean, now all the stuff that we know today, all the different technologies, platform solutions, and the tremendous amounts of revenue being driven by the web, I compare that very closely with the mHealth marketplace today. There's so many different solutions, platforms, applications that can be applicable to this marketplace. Even technologies that are, you know, getting their phase 2 reintroduction within this marketplace. And one of the things when we formed this panel, we wanted to give kind of a wide view of kind of those applications and solutions around that. And I think the panel, a lot of the panelists today have really outlined very compelling platform solutions and applications in those areas. And you know, overall, it's hopefully informative, and you guys have taken something very well away from this. Go ahead.
I'm a physician with an electrical and computer science background, and one of the things that concerns me a lot that I think this panel sort of addresses is the problems with security. No matter, even with encryption, even like you look what happened to General Petraeus, right? You know, it's in terms of overall security, in terms of locations, you have to mask your MAC address, you have to mask your IP addresses. To me, and then like Microsoft's new operating system, it may not mean much to a lot of people, Windows 8, but it has dramatic security improvements over people being able to hack into it over Windows 7, and some complicated stuff dealing with the hardware and the software, and then even using an Ivy Bridge processor over the previous Sandy Bridge has additional, like it has a hardware random number generator, which actually has impact in terms of security, and the ARM processors on our iPhones don't have it. And to me, I would never want to trust my records, knowing what I know on these even private clouds. I would always try to obscure it, because there should be some sort of metric tool, and I wish one of your platform providers would do it, that goes through absolutely everything that we know about and gives a rating indicator, like the New York Department of Health in restaurants gives a letter grade, A, B, C, D. And of course, nobody wants even a B letter grade. And we need some sort of simple metric when it comes to all this sort of security, everything going on, so people don't know where your IP addresses or anything is, because eventually they can hack into your systems. And I was just, that's kind of an open-ended question, but can we please address that?
I'd like to just answer something really quick to that. You know the expression that they make radar detectors in one half of the business and then, radar guns in the other? There are always going to be ways in circumvention to security. There's no such thing as fully bulletproof. And as society moves forward, and I think, you know, you mentioned Facebook. I mean, Facebook is an indicator of our future. And that means that we care less and less about our privacy and are willing to give more and more up of it for the time it saves, believe it or not. And that's why text messaging has taken off so much. It's just that streamlined way. Can you completely secure something locked down? Not even a voice call can be that way unless you have super encryption and, you know, like a micro encryption client like Sean has here. I mean, it's something that you absolutely need to nail down both ends. So there is no such thing as absolutely bulletproof. All you can do is your best and really put forth different efforts, not just on the technology side, but education. Education is the key to not giving away all your information.
Yeah, and that's what part of this panel obviously wants to focus on a lot around security. Sean, maybe you can walk this group through how you do that encryption, how your product works in that regard.
Sure, absolutely. I mean, just to do a quick follow-up again on the last question, and I'll lead into this as well, just real quick. I think you know, the key thing is to continue with the best practices. And if you do continue with the best practices and something, you know, God forbid, happens, at least you've followed through with the guidelines. So the potential penalty coming for, let's say, you know, HIPAA and so forth would be minimized because you did continue with all of the necessary practices. So now going, I guess, back into encryption and security. I guess it's very common that everybody says if you really want to be secure, you got to unplug your computer from the wall, right? So, but we do, you know, take the best practices and we do apply those into developing applications. And we've been fortunate enough that our background in our company comes from many years ago, developing, you know, co-developing the antivirus for which is today is the Symantec. You know, so we've been developing a lot of different technology, lots of different security-related apps, and then developing applications that met the guideline for government. So not only we're focused on security for HIPAA, but our applications have to meet the security that's required for government and variety of agencies. And that means it has to be, you know, FIPS certified and has to meet the necessary, has to have those encryptions in place. So what we've done is we've created a practice that to follow the guidelines of building secure application. For example, we do have a gateway that routes and sends SMSs and so forth, but the gateway was designed from ground up to be handling secure messages and being able to route messages securely. Today's SMSs are clear text. So you can actually, you know, if you go on the wire, you can see it. And in fact, not only that, we have devices called interceptors. And it says it's a small device here. You can turn it on and you can tune into anybody's cell phone and watch their SMSs and listen to their phone conversations. So, following up those different focus, trying to build secure applications. Again, as I mentioned earlier, not only the design has to be secure, it has to cover end-to-end encryption. And it also has to, at the same time, it also has to be compliant and it has to provide audit capability. You got to be able to roll back and look at different situations of who said what and when, who got paged what when, you know, who replied to different things, and be able to roll those scenarios. So those are obviously all have to be optional and provided. And at the most important part is one of the key things that we've discovered when it comes to security is the key that you use to encrypt your messages. And if you rotate that key fast enough and frequent enough, it becomes extremely hard to decrypt these messages. Even if you get a hold of the message itself, it just becomes, very, very hard. So if you have an end-to-end encryption and you rotate these keys fast enough and quick enough, then it becomes really, really hard because you're just spinning everything around and around, and it becomes very, very difficult to decrypt those. Sure.
I use GPG mail, that sort of thing.
Very familiar.
You can't really rotate the keys in that, can you, or can you?
On
Maybe
the,
it's too detailed. But maybe everybody else wants to know that. 'Cause this sounds like a great idea,
security.
but how do you
Right.
how's it implemented with the
right.
standard?
Depending
I
on
mean, I
the
have that on this thing.
right, depending on the security algorithm that is being used. For example, on AES, you can actually rotate those keys and policies that are set within the application. So what we use for our pager, a lot of the technology came from our government applications. So it does have a policy that somebody sets and says, hey, every day or every hour or every week or every month, whatever, rotate the keys. And it happens without the user even knowing it, but the keys are constantly rotating in the app. So if you have if you get one message and you connect it to the supercomputers and let it run for 100 years and you finally break it, the next message you grab, you have to start over again.
Thanks, Sean. One final question, or if anybody else has questions, please stand up or step up to the mic. But one question I have, and it's geared towards Rajiv at Qualcomm, is regulation plays such a big part of healthcare. Going through the development of the TUNET device and the platforms, you guys have put tremendous costs into creating and getting implemented and taking to market. What are some of the challenges that you guys have run into, and how have you either overcome those or still working through those today? Maybe you can talk a little bit about that.
Yeah. Obviously, security has been on everybody's mind, and so that was one of the things that we had to do from bottom up. In terms of regulatory and process quality controls, like 510K, FDA Class 1 MDDS, even ISO 13485 quality standards are things that we had to put in place right from the beginning before we even started working on this at the design level for controls that are required, along with aspects of security and privacy that had to happen from an end-to-end standpoint. And then there's, different devices will be, so once we put all this in place, then we actually tried to connect up to different devices, and that's where one of the biggest challenges was, because every device talks a different language. A lot of them are on proprietary systems, and their security levels are very different. And even now, based on what we know in this young industry about wireless healthcare, we know that what are best practices, but when we try to go back and share those with device manufacturers, they really don't want to put those in because they've put in a lot of time, money, and effort to build their devices, and they've got an FDA approval. Now, if they're trying to make any change to this, whether it's a software change to the code, firmware change, or hardware change, that means it's a whole approval process all over again. So they don't want to drive that. So how can we make the industry move forward collectively? So our roadmap needs to match with their roadmap and over time. And things are still pretty young. And some of the secure aspects at boot time, factory sets and everything, that requires you to go to the source of manufacturing and put those controls in, as well as you want configurability that if something does break, can we update it over the air so that we can get a new algorithm in place or a new key in place. We think of those things every day. And, but I think for us, Qualcomm coming into this, a wireless technology company coming into the healthcare space, the biggest challenge was the technology life cycles. Phones, we're so spoiled nowadays. You get a new phone by your carriers every year or so. Phones change every 6 months. The one I always like to use is, the weight scale. It's in your bathroom, it's in your bathroom, it's in your bathroom. How often do you change it, right? It really doesn't have, that's a typical aspect of, for these guys, the life cycle is a year or two, even 6 months nowadays. For medical devices, healthcare devices, it's around 5 to 7 year life cycle for the device to be churned out and a new device comes in. It's speeding up. But then if you compare those life cycles to get them to catch up, you want new technology in there, but then how do you get it in there at the right time and place? So, everything that we are collectively working through, but ongoing challenges. Yeah.
Thanks. I'd like to thank all the panelists for participating in the panel. I thought it was a wonderful panel, and I'd like to thank you all for attending. We're running over on time here, so I'm going to wrap it up now, and we appreciate you coming. Thanks.